The World Health Organization is sounding the alarm on 55 countries where international recruitment of their health workers could have dire domestic consequences. Of this number, 37 are countries on the continent Africa. Ghana, Nigeria, Zimbabwe, Zambia, and Senegal are a few of the 37. The pandemic ravaged healthcare systems across the world, critically affecting the workforce. And that's why many developed countries are aggressively looking outside their borders, many times outside their continents, for new hands. This cross-continent recruitment is dwindling the already few numbers of health workers in many African countries. And now some leaders are fighting back to keep their trained doctors and nurses and allied health workers in their countries. Zimbabwe has hinted of making it illegal for the recruitment of their health workers. You take Nigeria. On the other hand, the country is planning to introduce a law that ties down locally trained doctors for 5 years before being fully licensed. Today on The Square, we want to look at the pull and push factors, as well as how best governments can support their health workers. I am Keminni, Amanor, and you're welcome to The Square. Joining our gathering today in the studio with me is Adefolarin Opawoye. He is the PRO of the Nigerian Infectious Diseases Society, and I see you smiling. I hope I got that right.
Well, we will manage.
I tried.
We will manage it. Thank you very much for being here. Happy Easter. Yeah.
Happy Easter to you too.
Same to you.
We also have James Sibanda, who's joining us via Zoom from Zimbabwe. James is the deputy team leader for the Zimbabwe Health Workers Apex team. James, you're welcome to the program.
Thank you very much, ma'am. How are you?
I'm doing great myself. Now let's have the conversation about your profession, about your vocation. I'll start with you, Adefolarin. Recently, we've had the National Assembly putting in plans to lock down some doctors. I'd like to pick your thoughts on that.
Well, I mean, it's really amazing because when the news hit the web, that it was just clear that the proponents of the bill had displayed a woeful ignorance of how the system actually works. You know, because what they were trying to do was to say that, I mean, if I get it right now, that they want to issue them a provisional license for 5 years to quote unquote force them to work within the country. Mm-hmm. And then when they are done, then they can give them their full license.
Absolutely.
But that's not how the system works at all. Because once you graduate, you are issued a provisional license. And then after that, you have a period of internship or house job, we call it, where you work under supervision. And then after that, you get your full license before you go for your National Youth Service Corps. So are they saying now that you're not going to have your full license? That means that you are saying these people would have to work under supervision for next 5 years? Is that what they are trying to promote? I mean, are they talking about...
So that will mean that changing the existing laws around licensing...
Changing everything. Changing everything, and to what end? That's the question. I mean, you have a lot of doctors in country already who are by name doctors. They are not practicing. I have a colleague, we graduated together over a decade ago. Since we left the medical school, he has never picked up a stethoscope or a syringe. He has been a cameraman.
Oh, I see.
And he will tell you that he makes more money from taking the picture of a naming ceremony than taking a delivery of a patient. So that person is on the register as a doctor, but he's not working. How do you address that?
Okay, so I'll have us go into some of the issues in a moment. But let's hear from Zimbabwe. The deputy president who doubles as the health minister of your country, James, if you're still here with us, has said that he plans to criminalize international recruitment. I don't for a second assume that this is good news for you, but put it into words for us.
Sorry, I can't hear you correctly. Come again.
Yeah, indeed. I am asking how health workers feel about the recent remarks regarding international recruitment, which the health minister, cum deputy president, mentioned days ago.
Okay, thank you very much on that one. Allow me to highlight that a barrage of laws will not solve our crisis. What Zimbabwean health workers are looking for is just a living wage. There is need for the government to engage its workers to find the solutions to the challenges that we are facing. Currently, we are facing a situation whereby health workers are not being remunerated well, such that it becomes a pushing factor for the health workers to leave Zimbabwe for greener pastures. So for us to stop this brain drain, the first point to address is remuneration. I tell you, there is no way out we can have well-trained youth professionals, well-qualified people wanting to leave their nation just for the sake of living. There is a pushing factor. The pushing factor is poor remuneration.
I see.
Give them good remuneration, you will see these workers not going out. Unfortunately, this is not the case in Zimbabwe. We cannot rely on putting laws to say we would allow you to go out because you are destroying the system. No, what is destroying this is the poor remuneration. What is destroying the system is the poor working conditions, where there are no medicines, there is no equipment to use. Avail these to the health professionals, and then the problem will be solved.
James, I'm going to come back to you. James, if you could just hold on for me, I'm going to come back to you in a bit. Adefolarin, you would also want to reason with the government on why they're planning to do this, or why they want to, put in this stopgap measure now because of the numbers that keep going abroad.
Amanor, we're in this country together where we actually have been denying that there was a problem for a very long time. I mean, this is something that we within the sector, we knew has been an issue more than 10 years ago. But every successive government has kept denying that, oh, yes, we have enough, we are producing export. I don't want to mention names. You are all aware of this. So the fact that they haven't acknowledged that it is a problem means they have an insight. So it's a step in the right direction. But then, is this the solution? Of course not. Okay. So yes, there is a challenge. I'm telling you.
How big is the challenge? If you could paint us a picture of how dire the situation is, okay, what would it be?
I don't want to mention names, right? But I mean, there was a particular teaching hospital where, I mean, we train the super doctors, the residents who go on to become consultants, specialists, okay, that are trained to take care of each unique ailment. For example, you could have nephrologists, gastroenterologists, and all that. And so we're saying, okay, we're doing incoming exams, application exams. People should apply, okay? Now, I tell you, 4 or 5 years ago, we had about 200 people apply for the same position. You understand? And then there was a particular interview that was done last year, and then we had only 3 people apply. I mean, that's alarming. Yeah. Now, I mean, that means that 4, 5, 6 years down the line, that's even if the 3 people finish. So we have a situation where those 3 people may come in, and then within a year, they have all left to the UK. So in fact, they are now using some of these places are just stop gaps, while trying to gather money to write these foreign exams. So I can assure you, and we're talking about the city. Because, a lot of times when we're looking at this, we're not looking at what is going on in the rural areas.
Indeed.
You're looking at the doctor-patient population, you're looking at it in the city. There are entire stretches of thousands of kilometers of land in this country that you don't have a single doctor there. Sometimes you have a doctor, you don't have any specialist. So, I mean, they are the ones that are even facing the brunt of this worse than whatever we are facing in the urban center. So it's a big problem, and something needs to be done about it. But is this the solution? No.
Okay. So what we know has happened now also is the fact that the UK has responded to this red list alert and is saying that, they will not be recruiting anymore.
That's the UK.
Yeah, but it's always been a destination of choice for practitioners.
Why is it a destination of choice? Because it's easier to access. With about 1.5 million, you can easily do all the UK exams. In fact, there are now systems, because recruiting agencies too are smart. So when they see that people are having problems with people with payments, they say, okay, fine, don't worry, come, we'll pay for you. And then, or we'll give you a loan, you'll pay us when you start working, once you get a job. So that's why the UK has been a destination of choice. But that's not the only country. I mean, a lot of people are going to the US, people are going to Australia, a lot of people are going to Canada. We had the situation where some years ago, they had to close their recruitment center from the Middle East in Abuja. So, I mean, so UK is just, it's just one of these countries. And the question really is that this just looks like paper, how do you actually monitor? How do you enforce this? How do you enforce these so-called rules that you are saying that people should not recruit? Because they also have a problem in their own place where they don't have enough doctors. And believe you me, they will do anything they can to get doctors, good doctors.
I'm going to come back to you and ask you why you are still here.
Okay.
And
people ask a lot of that question.
I see the smile that came with it. I can imagine what the response would be. But let's go back to Zimbabwe and understand, the kind of situation health workers are faced with in that country. James, if you were to paint us a picture of, how the system is over there, what would it look like?
I'm having poor connection here. Please come again.
I'm asking you to describe, the poor conditions, the push factors that cause you to want to leave the country.
The causes of people wanting to leave the country.
Yes.
Number one, as I've said, is poor remuneration. Number two, poor working conditions. So what we are saying is, under the remuneration, the government should pay Zimbabweans, health workers, a living wage. I tell you, they won't leave the nation.
What are you paid now? What are you paid now? And what is it in a dollar equivalence, just to paint a picture for the rest of us to understand?
Come again.
What is the average pay for health workers in Zimbabwe?
Or the average pay for health workers? For now, I would say it's about 300 to 400 US. That's an average pay for a health worker, as we speak, which is not enough to cater for the needs.
Interesting. 300 US dollars?
It's terrible.
Wow. And you were talking about the working conditions. When you mentioned that, what were you referring to?
Sorry?
Explain to us the working conditions besides remuneration. Well, I'm not sure he can hear me, but I still have Folarin here with me. Folarin, when you hear that,
I'm sure you didn't know that doctors were paid so low, right?
I'm a bit shocked because times have changed. I know that back home in Ghana there were times that doctors also they went on strike so many times because of their salaries, but changes occurred at some point. What is the situation in Nigeria?
Well, I mean, it's a bit similar to what he's saying there. I don't know the level he was talking about where they are being paid $300, $400, but what I can tell you, even if it helps, is that for a professor now, the average salary of a professor here right now, based on the current exchange rate, is about is less than $8,000 per month. And I mean, it's almost equivalent to the salary of a laborer or a waiter, a waiter in the US. To be honest, it's really appalling. Now, that being said, I'm not a fan of just saying increase salaries, because at the point of increasing salaries, eventually what you just do is setting doctors up for destruction and putting a target on their back for extortion, for robbery, and even for kidnapping.
No, but if they deserve it, they should have it.
I'm not saying that, because the health sector is not just doctors, and that's another major problem with this bill.
Indeed.
No, doctors are not the only ones living. Nurses are living in droves. I call nurses the ancestral spirits of the hospital. They are the ones, they are the foundation on which the hospital is built. They are the ones that carry out the instruction of the doctors. They are the ones that give medications, they relate with the patient. They are there 24/7. And they are living. What are they doing about them?
And lab technicians as well.
Technicians, the radiographers, the physiologists, everybody of value is fleeing this country. So then when you now put that overall emphasis on doctors and you find a way to keep them, then what of the nurses? Or then, I mean, how does that solve the problem? So the doctor has come here, has seen the patient. Is he also the one that will take the patient to the lab? Is he also the one that will wash the patient? Is it the one, So it's just a very myopic way of trying to deal with the crisis. You understand? But like I said, I'm not a fan of just increasing salaries. Yeah, good money is good. But you see, what we have seen also is that when salaries are increased without being relative to inflation, So it's just like you are just having movement, without motion. You get, and we're like, look, instead of just increasing recurrent expenditure, why not create systems? Put doctors on a mortgage. Let them not have to worry about their housing. Let them not have to worry about their children's education. Let them not have to worry about their health. There are a lot of doctors who, for one reason or the other, if they fall sick, they can't afford care in the hospital, they are working. I mean, that's alarming. And I know people who have left the country because of that. I have a friend who had that type 1 diabetes. When people with type 1 diabetes, they could easily have renal failure. And she calculated the cost of having to go on dialysis in Nigeria. It was going to be very obnoxious. She can't afford it. And she said, look, let me go into a system where all my needs are sorted.
Right.
So this issue of leaving the country is not just based on cash. I had people that left because of their children. I had people that left because of their families. So these are issues that we have to look at in totality and not just focus on one very microscopic.
Absolutely. And like James mentioned over the Zoom, it's not only the money. They also want the working conditions looked at. What would you say about the case in Nigeria?
No, it's the same thing. So, for example, I'm trained as an infectious disease specialist, and you see, for all of us in whatever specialty we have learned to make do with what we have in very, very suboptimal conditions. But let me give you the example of a neurosurgeon, for example. A neurosurgeon spends about 6 to 9 years in training. And that 6 to 9 years in training, they work almost 20 hours per day. Sometimes they can be in surgery for 10 hours. So imagine after you do all that, and then you cannot practice your skills because there's no CT scan or you don't have tools. And the way this thing works, it's not like driving that once you learn it, it's with you for life. With these skills, if you don't practice, you lose them. And then it becomes counterproductive. I've spent a whole lot of my youth doing this, and then I can't use what and some people have left because of that. Because all of a sudden then you see people that you probably started out together who left the country, and they are now miles ahead of you. And these are people that, to be honest, intellectually, you're probably maybe even superior to them. But because they were in an enabling environment, they were in an environment where they could have a lot of experience, they could have mentorship, they had all the resources they need, then all of a sudden they are achieving more than you, they're writing more papers than you, they are doing more things than you, things that you can't even dream of. I mean, it could be disheartening and depressing at times.
I want to go back to James and see if we still have James over the connection on Zoom. James, if you can hear me, I know that Zimbabwean health workers, even this year, have embarked on some, strike actions, which forced the government to criminalize strike actions beyond 3 days. My question to you now is, what kinds of engagements have you had with government regarding your remuneration, your working conditions, and what have the results been in those engagements?
Thank you very much. That's a very interesting question. It's unfortunate that there is no engagement taking place, I think, for quite some time now. The government has adopted, I think, an approach where engagement is very minimum, but lawmaking is high. It's unfortunate. Or whatever is happening, it needs engagement. I would urge the government to engage with its workers so that whatever problem that we are facing, we can find solutions together. Unfortunately, there is no engagement for now, and we don't know when we are going to engage with our employer, or let me say our government. So as for now, we don't have any engagement that is coming out. All the laws that are coming out or that are being put in place, they are just put in place unilaterally with no workers involved. That is the unfortunate part.
I see. When we come back from the break, we'll delve deeper into this issue. We'll find out, whether or not perhaps James is looking to outside the country for greener pastures, as I said, and find out from Folarin why he's still here with all that he said about the system. We'll be right back. Welcome back to The Square. Today on the program, we are discussing our health workforce on the continent. As you may well know, greener pastures are calling elsewhere, and many of these health workers are leaving. The WHO has sounded the alarm on, the effect this could have on us. So we are discussing this with two health workers two practitioners from Nigeria and Zimbabwe on this. They have been the two countries that have been on the red list and have had some reactions from places like the UK. And Adefolarin Opawoye is here with me. And I also have over Zoom James Sibanda from Zimbabwe. Gentlemen, thank you for your patience. And I stick with you, Adefolarin, on this one. Initially, you mentioned that, the discussions around the, the law or regulation or whatever it is that the National Assembly was putting together was based on ignorance. Yeah, and so here's my question. Have there been any interactions with the medical profession, with the health workers on perhaps making input into this?
Well, I mean, it's clear, just like James complained about from Zimbabwe, that there has been not much interaction between the lawmakers and the people actually affected by these laws. It's clear that the Medical and Dental Council of Nigeria is not involved in this. The Nigerian Medical Association is not involved in this. The Nigerian Association of Resident Doctors, they are not involved. Even the NIMSA, that's the Nigerian Medical Students Association. You understand? All these are key stakeholders. You understand? Who can actually say that? You see, the question is as a proper situational analysis has it been done to say that, okay, why are people leaving? You understand? And then what do you think are the solutions? Have they asked the people that are leaving why they are out there? In my particular set, I have more than 50 of my colleagues in the UK. Some of them are diehard.
Over what period?
Over the last. So it's a kind of like a bandwagon effect. So you understand, you're all in the trenches together, quote unquote, in Nigeria, and then one of you leaves, and the next thing you see him taking pictures,
and it
you
looks
see his
good.
car, like, oh boy, I'm like, guy, you're smart. What are you doing here? I mean, of course, you can pass all the exams and all that. We speak very good English, better than most European countries. Because English is almost more or less almost the first language for a lot of people here. So we are very desirable out there. And then you immediately, within a month of living, with the same level of education and achievements, you quadruple your earnings. I mean, tell me why you would stay.
Why do you want to stay? Why have you stayed all these years?
So the reality is that, for some of us, we've been able to find some joy in working here. And for some of us, it's about making impact and being able to have a legacy at the end of the day. It's not just about the raw cash. Really, I mean, if I leave the country today, I stand to gain much more financially than being here. But maybe I wouldn't have the level of impact that I have here. As somebody who has been in the forefront of all the outbreaks we've had so far. I mean, the state and the country, Ebola in 2014, Lassa fever, COVID, monkeypox, whatever, and you are able to directly, let me give you an example. I mean, 2 weeks ago, I had to see a patient who came in, and for all his word, he had fever, he was bleeding, you understand, and they thought he had Lassa fever, which is a big problem in Nigeria, right? And then I looked at him, and okay, we didn't have access to laboratory facilities somehow at that point. And they looked at him and was able to deduce that, look, because of some certain clinical features that were not clicking, this is not the case. And they were able to go in and then operate him, and boom, this guy walked out of the hospital 5-10 days later. And something told me, if I wasn't there, I would have died.
Yeah.
And those are the kind of things that says, look,
some of the cases that happen.
Not everybody can go. Some of us need to stay and take care of our people. That's why some of us are still here.
James, we hear reports of 4,000 nurses having left the workforce in Zimbabwe. And at the moment, you have about 3,500 doctors for a population of about 15 million. That is putting, the doctor-patient ratio way over the board when it comes to the standard. I want to ask you, is this not a concern to people in the practice who are bent on leaving the country?
It's okay. Let me come to you and address that fact. Having a doctor-to-patient ratio that is too high cannot be solved by encircling the ones that are actually working in the system. Yes, it's a problem, but why not recognizing that doctor who is already working in the system, give him or her whatever he or she wants, and then we start working on improving the number of doctors, or let me say, the health professionals that are needed. We can start by training. Let's say we need to train more of them, but as much as we're training more of them, we need to recognize those who are already working and give them a living wage that will not force them to leave the nation. Let me put it straight here. African nations should learn to respect their health workers. That is point number one. Trying to cage them or encircling them, it won't work. We are dealing with professionals here. Encircling them will not work. These are...
Well, I think we lost James there again. That's a shame. When we get James back on that connection, we will finish that point he's trying to make. Really important point about what will get, you know, these health professionals to stay in the country. Our discussion today is on the health workforce on the African continent. Nigeria and Zimbabwe being our focus. Fortunately, here in the studio with me is Adefolarin. I'm getting there.
You're getting there.
Yes. Adefolarin. And so what will make, I mean, if you were to itemize the things that could make our health force stay here in Nigeria and treat people, what will be the contribution that you'll be making to that list?
Well, I think that, you see, it's a multifaceted problem, like I've said. And the first thing is to try to find out why people are leaving. Okay, those that have left, why did they leave? Are they ever planning to come back? If they are trying to come back, when are they planning to come back? Those that are staying, why are they staying? When you do that analysis, I mean, that's where you should really start from, so that whatever information whatever measures you're trying to put in place is based on data and not just conjecture. You know, and then when you do that, I mean, you will probably find things like remunerations, like Mr. Sibanda talked about. It's a big deal. You understand? You don't want to be a doctor, you're struggling to meet your own needs. I mean, about colleagues who, husband and wife, were both practicing in the same hospital, they were holding salaries for 6 months. I mean, they had to send their children away because they had to be on perma fasting. You know, they couldn't eat. It's difficult, it's shameful.
So I don't know the official numbers of health workers who have left Nigeria yet, but if Zimbabwe is 4,000, then I can you know, dare say that I could be triple the number here in Lagos. So it means that there is a gap now that needs to be filled.
There's definitely
what do you expect the Nigerian government to do in the interim, or as a stopgap measure, so that, you know, people in rural areas, because even in cities like Lagos, sometimes you don't find specialists, sometimes you don't find doctors at certain hospitals. So for those in the rural areas, you can imagine that it's even more dire.
It's far
so
away.
As a stopgap measure, is there anything that the government could do?
No, you have to make practicing in these rural areas, you have to make it more attractive to doctors. So, for example, one of the challenges is that many of these rural areas don't have good schools. So you wouldn't want, because you are practicing it, I mean, there your children will have to either be homeschooled or go to a very substandard school. So 2 things: either you're raising the level of education in those places, or you allow the doctor to be able to put his children in good schools in town somewhere. You understand? You have to pay him some remunerations, make sure that he has access to all the equipment he needs. Because, I mean, again, you can't be a neurosurgeon and say you're going to go to a village. You're not going to be able to do anything, and your skills will just become rusty and die with you that way. You know, so for the rural areas, you have to improve, make it more attractive for doctors to go there.
Right.
You understand? And for the urban centers, like Mr. Sibanda said from Zimbabwe, appreciate the people you have and treat them well. Make it attractive. Now, we have a lot of people who are children of medical professionals who are vowing never to do what their father did, because they see their father every time they say they want to buy a bicycle. The man will say, wait, we are coming, we have to plan. You understand? And then they look at the man downstairs, but probably is even doing Yahoo or is a tech person, and then he's doing very, very well. So they say, why should I follow his footsteps? So that's the problem. The profession is not as, it's said to be a noble profession, but it's not as attractive as it was before. And that's the challenge now. So you have to treat what the people you have, well, you have to, I mean, make it attractive.
You know, but I know we've spoken about this, but I just want to say again that it brings to question the level of service that these people who are training through the local medical schools on subsidized fees and the likes, well, maybe not here. No, maybe not here. But it brings to mind, okay, so where is the service? Where are the times when doctors like you say that, no matter what, I will stay, right? Of course, you may have your breaking point.
For now, I may not be here tomorrow. Let's be clear. Okay. For now, I'm here. At this very second, as I'm leaving here, I might get an offer that is impossible to refuse, and I'll be on the next flight.
I totally get it. But I'll come back to you so that, I want us to strike a very good balance between looking for greener pastures and, the desire to be of service to your people. But just, munch on that a bit while I go to Zimbabwe. James, you were making a point about what it would take to have your health workers stay in the country. Go ahead.
Come again, ma'am?
Well, I was just saying that you should finish the point you were making before, if you still remember what it is. If not, we'll move on to something else.
Okay, I was talking about the issue to do with the retention of the health workers, of which the best way is to make sure that there is engagement between the government and the health workers, number one. Number two, out of those engagements, let's have proper and good remuneration. Let's have recognition of a health worker as a very important cadre that the nation cannot away. In that way, we can have better things. We can have a better working system in the health sector. Another point is, let the African nations put a lot of their budget towards health. A health nation is a wealthy nation. If we are to adopt that strategy, I think Africa can be a better place.
Very well. James, are you planning to take any action as a group against the health ministry or by extension, the government's plans to criminalize international recruitment?
No, as I was saying, there is no any with the government for quite a long time. For now, the government has been doing its own things without the involvement of the worker, coming up with a barrage of laws.
What I'm asking is, do you plan to take any action? What I'm asking is, do you plan to take any action against this move by the government?
It's a very good question to ask. But for now, if you look at the situation, hands are tied up. We have got a law that has been passed whereby demonstration or taking a job action has been criminalized.
But why can't you go to the courts then? If this law is indeed passed, you could resort to the court. Is it an option that you're looking at?
Come again?
I'm saying that if this law is indeed passed as set by the deputy president, you could go to the courts. Is that an option for you as a group?
Yes, we can, but we cannot promise to get to get something positive out of it. Because if a law has been passed, the duties of the judiciary is to so we can't go to the judiciary and try to oppose the law that has already been passed.
Very well, James. I appreciate your time here. Unfortunately, that Zoom connection won't allow us to have a smooth conversation, but your insights on the subject matter is much appreciated. Thank you so much. Still with me here is Folarin. Let's wrap it up with Folarin. Folarin, I said something earlier about finding the balance, because if I live in the rural area,
the only thing that we can do is maybe say we are.
Well, thank you, James. If I live in the rural area where I don't see all of the things that you talk about, the only thing I see is the fact that I do not have a doctor, I do not have a nurse or any health worker. It's difficult for me to wrap my mind around what you're saying. So why do we strike the balance between service and the greener pastures?
No, well, I mean, I agree with you that we must be patriotic and we must try to give back to the country. But what is the country also doing for itself? You have to ask that question because, you see, it's so easy to blame the doctor for everything. But look, as knowledgeable, as skilled as I think I am, if I'm in a system where there's nothing I can do. I'm just this figurehead. I'm just this. So, I mean, it's revision is a bit reductionist to think that once you have the doctors, all the problems are fixed. These rural areas, do they even have the hospitals? Do they have power? Do they have running water? Do they have a theater? Do they have the medical equipment? Do they have staffing? It's not just a doctor. So, and that's the problem I told you. It was a totally ignorant view of the problems that made them to come up with that bill. What if I tell you that there are pathways where you don't even need to graduate? I mean, you can start writing your licensing exams in the US from medical school, right? And you don't even need a permanent license to move. So it just tells you the issues with that particular thought process.
And one of the things that came up in scoping discussions for this interview is the fact that the people who are passing, or planning to pass the law,
yes,
do they patronize services of Nigerian hospitals?
Of course.
And I guess it comes back to what you're saying.
We all know the answers to that. We all know the answers to that. So a lot of people have said, oh, they should prevent them from. And I was like, look, you cannot.
I've got to say that I appreciate your time, not only on the subject, but also choosing to stay for now.
For now.
Thank you so much.
You're welcome.
Olarin Opawoye is PR of the Nigerian Infectious Disease Society, and he's been sharing his thoughts on recent moves by the National Assembly to stop doctors from leaving the country until after 5 years. I hope that this discussion continues wherever you are, in your homes, in your offices, and even within the National Assembly. You hear from the doctors before this move is taken. That'll be all today on the program. Thank you so much for your company. Enjoy the rest of your Easter holiday. I'll see you same time tomorrow. Bye-bye.